Well, naturally, we want the conference to be obviously about what people are talking about what health systems are concerned with, and about what management teams are trying to handle on a day-to-day basis. So we sent out a survey towards the end of last year, and naturally the results of the election became front and center as one of the topics. But above and beyond that, I think it's clear to everybody that we're in a time of incredible change. So managing change kind of fell out as a good umbrella topic to cover a lot of areas. Whether that was change in the reimbursement models and payment models for health systems, changes in the way that they're handling health plans, whether or not provider-owned or for-profit or joint ventures, changes in kind of the way that care is being delivered, the way that the patient wants care to be delivered, as well as the way that the physician wants to deliver care. And even from the top level, management changes. As a lot of the C-suite and board turns over, what are incoming management teams going to view as their priorities going in, and how do they envision kind of their legacy going forward. So we're hoping to capture all of those themes and see, system to system nationwide, across different states and across different counties, how are they tackling those challenges. Like any essential service provider, it's not like they can hit the pause button. So they're continuing forward with their initiatives. Many are quite active on the political scene. They're working with organizations like the American Hospital Association, one of our co-sponsors, to kind of be in front of legislatures, in front of their kind of government officials, and make their opinions known on the one front. And then just operationally speaking, I think they're continuing with their initiatives going forward, whether that be mergers and acquisitions and partnerships, or divestitures or joint ventures, things like that. So it's a matter of just trying to figure out how to move forward with initiatives, while at the same time, I think, tightening their belts, kind of trying to be prepared for if payments and reimbursements to them decrease, frankly. But I think despite all of that, what we're seeing from the capital market side, at Citi at least, many of our clients are still issuing debt. They're still trying to move forward with financing new projects, new strategic initiatives, things like that. And going forward, what we are still going to see, we think, is issuance of taxable debt as a method. It gives our tax-exempt issuers a lot of freedom and flexibility, just technically speaking, legally wise, to use the proceeds in a manner that they see fit. And in the current market, with interest rates so low and the capital markets in general so accommodative to various products, the differential in cost between taxable and tax-exempt is still fairly small. So we expect to see that going forward, and I think the purpose of things like our investor conference really help our issuers to kind of find a way to bridge the gap between themselves and their investors and try to be transparent, kind of alleviate those concerns, and talk about the ways in which they're modeling things going forward and trying to be ready for whatever changes may come down the road. I think they're dealing with all of the management changes, the payment model changes, kind of how to deal with their health plans, et cetera. But one thing I would say is that while managing so much change, one point I made earlier was about them still trying to kind of cut costs while still moving forward. So we see a lot of our clients addressing questions that try to get to the heart of what is core versus non-core to their business, and what's essential to both their mission and to their survival. So some questions that we see them addressing are things like, do I continue with my lab business, or do I sell that or partner with someone else to operate it? Similarly, do I run my own home health business or behavioral health line, or partner or sell or joint venture for that as well? If you're an academic medical center, you're kind of wondering, do I continue to stay independent, or do I affiliate or merge with a larger system? And on the flip side, the larger system is thinking, do I need an academic medical center? Do I need research, things like that, in order to fulfill kind of the whole continuum of care? So we're dealing with a lot of strategic questions, I think, for health systems to continue to kind of be ready to manage change going forward. In terms of, in particular this year, things that are related to the theme are certainly going to be exciting for us, from our keynote address by Mark Halperin, who's a political commentator who's going to talk about insights into the Trump administration in the first 100 days, as well as, of course, impacts potential impacts on AC and AHCA. And then we have two great panels lined up too. One investor panel with some very smart, very thoughtful, and dynamic investors in the audience who are going to talk about their hot topics and hot buttons. And another panel talking about unconventional strategies and how that drove success in managed care businesses, which is certainly also a big topic.